The theme for World Cancer Day 2023 is closing the care gap. What we need to ensure is that every patient with cancer gets the right treatment at the right time.
We as oncologists pledge to close the care gap and request you to join the global awareness campaign to help us create a healthy, brighter world without cancer.
Help you understand how to cope with cancer so that we can detect it and cure it early.
Cancer of any type or any stage is treatable. Do consult your doctor.
So let us all work together and hope for the best for all our patients.
On the occasion of World Cancer Day, we as physicians pledge to do our part in reducing the cancer care gap, which is the theme for World Cancer Day.
Nowadays, with a lot of advances available in radiation oncology, you can get treated with very less side effects, less time, and without any major implications to your future.
As by now you know that cancer is one of the major killers in our country as well as in the world.
There are several inequalities which result in the cancer care gap, such as gender bias, differences in ethnicity, income, and age.
Hematological diseases and blood cancer are potentially treatable and potentially curable diseases.
While there is a lot of fear about what cancer can do and what it means, there's also a bit of a glimmer of hope, because today's understanding of the disease and its treatment are possibly the maximum in the history. And if we know that a cancer can be diagnosed in the early stages, there's a lot of hope that we can be curing it. So I would urge you to overcome your fears and get in touch with your caregiver to find out what are the early signs and symptoms, how one can detect, what are the treatments, and thereby you can maximize your chances of surviving this disease.
Breast cancer is increasing at an immense rate in our country, especially in the younger women, especially around the age of 35 and above.
We all know that cervical cancer can be easily prevented, and this can be done by HPV vaccination of young girls between the age of 9 and 26.
Remember that if you are diagnosed with breast cancer, today with the advances in surgical techniques, you do not have to lose your entire breast.
Let us promise to never surrender, nor let anyone surrender in your family or your friend circle to this dreadful disease.
So let's all build awareness and do our bit to reduce the cancer care gap.
In the past, cancer was a word that actually struck fear in most people. Today, we are far away from that period of time, or what we call as dark ages.
As a nuclear medicine physician, we provide PET-CT services, which is one of the inevitable tool in cancer care. We aim to reduce the care gap and create a future without cancer.
We have modern treatments, we detect cancer earlier, we have multidisciplinary teams all working together to bring about change in patients' lives.
This awareness program is to dispel the various myths in the community regarding cancer. The aim is to dispel your myth and to remove the fear from your mind.
So on this day, let's all stand together and at least strive towards making cancer a word that is more acceptable, and so that knowledge is freely available to everyone.